Hi everybody, I'm Dr. David Granet, and welcome to a special edition of Health Matters. You might see little Petey here on my lap, and that's because we're going to talk about animals and how valuable they are to human health. To do this with us, we have a very, very special guest, Dr. Ruth MacPete. Welcome.
Hi, thank you.
Dr. MacPete is at the La Jolla Veterinary Hospital, and she's been a news correspondent for a local NBC for many years here, and is kind of one of our local celebrities. And I had her on because I think that she's the best there is to talk about all this, and so I'm really excited you're here.
Thank you for having me.
The last show we did on this topic got a lot of interest, and we had to do more. And I am so excited that you brought Petey and Petey's friend.
This is Petey's friend, Hagrid.
Yes, and Hagrid and Petey live in the same house.
They do.
So cats and dogs can be friends.
Definitely.
What we're talking about today is how pets affect human health. And I think that most people don't think about the value of having a pet.
Yeah.
What kind of things can pets overall affect?
I mean, I think most people that have ever had a pet or have a pet now know that they provide some value. They know about the fact that they relax them, they provide unconditional love and companionship. But there's so much more that a lot of people don't realize, and that science has actually proven that animals are actually good for our health. And so that's really what this is about, is just how do they do that? And they do that emotionally. They provide a lot of emotional value for us. They provide a lot of physical human health benefits, as well as provide things for our family. And then, of course, even advances in veterinary medicine end up helping humans. And that's kind of what I wanted to talk with you about today, is share all the exciting information about how they benefit our health.
Well, I can't wait to hear it. I'm a huge dog fan, particularly. And so I'd love to hear more about it. I like the way you laid it out. Let's start with the emotional benefits, because I think that may be more obvious to most people. Yeah. You know, I'm happy that Petey's in my lap, just sitting here. So what kinds of things? I mean, obviously somebody who's depressed might like to have
absolutely.
An animal around.
And they, you know, some of the first studies actually looked at UCLA. They years ago looked at AIDS patients that had pets and then AIDS patients that didn't have pets. And they found that there was actually a significant decrease in depression that the AIDS patients felt when they had a pet. And they've now done some studies with Alzheimer's patients and found similar results, that when patients have a pet and share their home with a pet, they suffer less frustration, less anxiety, and less depression. And so it's something that a lot of doctors are doing because they know those benefits. A lot of doctors are actually including pets in their therapy. You know, for years we've known things like fish tanks are good, and you, for example, have a fish tank, a beautiful fish tank in your office, and it's just because it helps people relax. It helps people relax before they see a doctor or undergo a medical procedure.
Well, and preparing for the show, I was looking for some data, and I came across this really fascinating thing. 44 million households have dogs, 38 million households have cats, but 16 million people consider their pet their best friend.
Yep.
I mean, that's not a trivial number, 16 million people. And they really are friends.
They are.
And having a friend in this world is a big deal.
It is. And, you know, like we talked about, I mean, they just love you unconditionally. They're there for you. They greet you when you come in the door. As everyone can see, you know, they're relaxing me as I talk with you, and Petey's hanging out with you.
Yeah.
And, you know, they're here for us when we need them. You know, in times of happiness and times of sorrow, they're there for you. And it's not just dogs and cats like we talked about. You know, it's fish, and it's also things like dolphins. There was a really cool study in the December 2005 British Medical Journal that actually looked at treating depression in patients that had mild to moderate depression. They actually flew a group of patients down to Honduras. So you would think, well, a 2-week vacation is great for any depression.
Right.
But they actually split the group up and looked at half of the people and took them outside and did outdoor adventures. And the other half got to interact with dolphins. And they got to play with the dolphins, feed the dolphins, or take care of the dolphins. And at the end of 2 weeks, they looked at how was the depression, and they found that the depression was much better, and it alleviated the symptoms in those patients. And so again, it's just more proof that animals really can help with you know, depression, anxiety, frustration, a number of different things.
Along with the other data I found, I saw this other number that was 5 million people valued their pet as much as their spouse. I'm not sure I should ask about that question right now, but it just tells you about, I guess, about the important part about it. Now, one of the things I thought was really interesting is the idea that when you have a pet, it makes you be social in some way
Absolutely.
with other humans even.
Yes, absolutely. And it's funny because, you know, it's definitely something that I think groups like Match.com and eHarmony need to be worried about, because pets definitely make people more social. They give people something to talk about. Dogs get people out, so people are out and about and they meet other people. They make it just an easy conversation starter. And so there are a lot of people that have actually met by having a pet and fallen in love because of their pets. And so those companies need to watch out, because there's a lot of people doing things like it with pets as well.
Well, when I was a single guy back in the day, I mean, having a dog was a great way to meet a girl. I assume that still works.
Yes,
I don't know
yes.
anymore. And one of the things I came across again was 40% of dog owners feel like they make friends more easily.
Yes, yeah, there was a study, the study you're referring to was actually in England, and they found that people that actually had dogs felt that they made friends a lot easier than when they didn't have the dogs. And again, I think it's just that they bring out the best in people, and people want to greet the dog, they want to meet the dog, they want to talk about their experiences with pets. And so it's an easy conversation starter, and so people that are shy, it really kind of breaks down the barrier and brings people together. And, you know, I don't know if you noticed also too, these are a lot of the things that people know, but the animals help with a number of different people. We know they help. We talked about in another show we did before, we talked about how they help with elderly and they help with kids, but they also are helping right now with a population of people that people don't think about a lot, and it's the inmate population. And I don't know if you looked at some of those studies, but it's really amazing the effects they've had on some of the prison inmates. And they've, again, with emotions, they've helped these people find love again and learn to care for and value a living being.
Well, and the Kentucky inmates,
yes,
who when they finally get out of prison, want to take the cats home
yes,
with them.
Yes,
I mean,
yeah.
They're so attached.
Yeah, it's really neat. And they started that prison actually in Eddyville, Kentucky. They actually started a little adoption program where they wanted to get the cats paroled, as they called it. So they actually helped get the cats out faster. And obviously, they didn't wait for the cats to get out when they got out. They actually helped them get homes and return to the population. But you know, it's great. I mean, there's a lot of prisons that are doing that. There's a prison actually in Kansas, the Ellsworth Correctional Facility, that for 8 years has actually been doing something with an organization called CARES, and it's the Canine Assisted Rehabilitation Education Services program, and they actually are training guide dogs. So they're looking at training, you know, getting these inmates to do something incredibly valuable for society, where they're training guide dogs, because they have 24 hours a day, 7 days a week to work with these dogs, and it's good for the inmates. It's providing them a purpose. It's giving them knowledge in an area that they didn't have. Thank you for the kisses. And it's providing an incredible service to the community. This group, this nonprofit group, can actually offer these trained dogs, service dogs, for $500 as opposed to normally the $20,000 that it costs to train a service dog.
Well, and it's brilliant because if you have an incarcerated inmate, they need to feel like they're part of
Yes,
society,
yeah.
and they have to reintegrate. Rehabilitation in the prison system is argued about whether it's really achieved. And to
Yes.
think that such a straightforward, simple approach.
Yeah, the pets are doing it.
Right,
Yeah.
and perhaps the pets will actually stop people from being incarcerated in the first place.
Yes, yeah.
Which would be wonderful. Well, you know, the emotional aspects of it, I think that we're all in agreement. And what about the physical things? I mean, can a pet really change things like blood pressure or cholesterol? I mean, or do you need a medication?
Studies definitely show that cholesterol and triglyceride levels drop and that they go down when people have a pet. And blood pressure, the blood pressure studies are really clear. There's a lot of studies out there showing that pets decrease blood pressure, but there's a recent study that's actually interesting that was done from the State University of New York in Buffalo, and Dr. Karen Allen looked at a group of workers that are really, really stressed out, usually stockbrokers.
Stockbrokers, yeah.
And she looked at 48 different stockbrokers that didn't have pets, and it's a really neat study because a lot of times these studies look at people that already have pets, and so the question is there some bias with the people that have
Sure.
pets being healthier to begin with? And this study actually looked at people that never had pets, and they took the 48 stockbrokers and actually divided them up after they put them on antihypertensive medications. Half of them got a pet and half of them didn't. And then 6 months later, they looked at these people and found that the resting blood pressure in the group of stockbrokers with pets was significantly lower. It was actually in the normal range and much lower than the other group, even though both were on medication. And then they actually did stress tests and found that when they were both stressed, both groups, of course they had a rise in blood pressure, but the group with pets had a significantly less rise in blood pressure, and it was half as low, half a rise as the other group. So incredible evidence again that shows that they really do help us physically. And as you know, blood pressure is important for heart health.
Oh my
and
gosh.
that's one thing that we know that animals for years, some of the early studies have shown that animals help our heart. Not just, give us love and everything else, but physically. They looked at studies in 1995 that were published in the American Journal of Cardiology, and they actually showed that people that had dogs had a significantly longer life expectancy after a heart attack than people that didn't. So, incredible. And it's not just dogs, I must say to my cat friend over here, yes, that new studies have shown that it's cats too, that it's really the benefits of animals in general. There was a study out of...
Well, because, if you think about it, you have to walk a dog.
Absolutely.
But you don't have to walk a cat.
No, but
so it can't just be the exercise. No. If cats and dogs both help.
Yeah, it's just, it's a lot of things with, with cats, obviously petting them and, petting them and being around them. And they've, some of the studies have shown not just interacting with them, but visually looking at animals helps people as well. And, that's one thing that I forgot to mention that's really neat is there's a new study that looked at why do animals have all these benefits for us, usually emotionally. And this study actually found that just interacting with a dog visually or playing with a dog increased neurotransmitters, and specifically it increased dopamine and serotonin. And as you know, those are very involved in mood regulation.
We have drugs that do that.
Exactly, so like Prozac.
Right.
So if a dog could do, a dog or a cat has the benefits that Prozac does, well, it's not surprising that they are so good for us emotionally and physically.
I think it's a lot better to get PD to your house than it is to go buy Prozac. I mean, if we have a choice, cholesterol goes down, triglycerides go down. It's all good.
Yeah, and you talked about, another thing that you talked about that is the fitness aspect is that pets also, they get people out there, especially dogs. If you have a dog, obviously most people need to walk them. And so pets are really good for us, again, because they can help keep us active. They keep elderly people active. They keep everybody active. They get you out there. And that helps you not only stay active, but it helps with weight loss too. And so there's been a number of different programs kind of popping up in the last 5 years that are really aimed at getting people active and helping people lose weight as well as animals, because it's not just people that are overweight. Sadly, 40% of our dog and cat population is also overweight. And so we're really trying to do things that get both groups out there and get them physical and active.
And in this day and age, we always have to talk about costs. It turns out that this saves money in the medical system.
Yes. Absolutely. And some of the insurance companies have caught on to this. There's an insurance company, Midland Insurance Company in Ohio, that actually ask people in their screening tests that are 75 years or older, it asks them if they have a pet. And if they do, it tips it in their favor. And they actually get a lower rate because they know that that's how good pets are, that they really are good for us.
Well, if the insurance company is giving a lower rate, then we know that there's something there because they don't mess around with this. It's an expensive. There's a lot of money spent in the United States on pets, but I think that it's clearly worth it in that sense.
Absolutely.
One of the sort of other issues we're going to talk about is that the kind of developmental and family way pets touch your life, and I want to segue through that by going through a medical way, which is the immune system and asthma and allergies. This is important to me. My middle son has pretty significant asthma, and my older son has pretty significant allergies. What's the story? What's the connection between animals? Because most people think of animals as causing allergies.
Yeah. And that was definitely believed, several years ago, and they have now found that that's not really true. That lower doses of things, smaller doses, may actually, and early on, may actually help prevent allergies and asthma from developing. So, there's a lot of different studies that have looked at this and actually found that when children grow up in a household with pets, any pet, a dog or a cat, that they actually develop less allergies than children that did not have a pet in the household. And one of the most recent studies, there was a study out of the University of Wisconsin in Madison. Dr. Gurn actually looked at babies, newborns, and he took blood samples from babies right after they were born, and then he looked at them again a year later. And he specifically looked at the immunology and tried to look for what was going on in their immune system. And he was looking at a group of kids that had pets and a group of babies that didn't have pets. And he found what we talked about is that they actually did not have, that the people that, or the babies that actually grew up in a household with pets had different signs immunologically that they were responding, but in a positive way to having these pets. And so it caused some reactions in the body, but again, it was a good reaction. And so he found, again, when he looked at them years later, that they didn't develop the asthma and the allergies that other children did at a later
we
point.
were recommended to get an animal, especially for our third child, to help prevent him from getting the allergies. I think that's incredible because most people think of, if you've got allergies, get rid of the cat.
Yes.
But this is a whole different way of thinking about it.
This is obviously, ideally, we're losing all our hair here. Huh?
Yes.
Ideally, this is early on. So obviously we talked about if you have severe allergies, obviously a pet is not going to get rid of that at that point. And there are certainly people that have very severe allergies that cannot have a pet unless they do, allergy shots for the pets. But early on, yeah, definitely the research is showing that it is good for our children, and that having a pet, exposing them early, can actually prevent them from developing allergies later in life, and eczema and asthma as well.
Look at, Petey's chewing on my little card here.
And you're ready to leave on me, huh?
Yeah, but we're laughing.
Yes.
It does keep you lighter. The developmental issues for children, having the opportunity to grow up with a pet and having the friend to come home to who's always there for them. What does it mean?
It's, again, it's just amazing. I'm a huge animal lover, as you are, and they offer so much. And to children and to our family, they give kids a sense of responsibility. So as you've talked about before, your children learn to take care of a living being. They learn that they have to feed them, they have to take care of them, they may have to bathe them, they have to give them water. They learn kindness, they learn love, they learn respect for another living being. And those are just wonderful things that we want our kids to learn. And so growing up with animals, they learn all these things. And like I said, with the inmates, they found that they're learning that too, that they're relearning how to be good members of society and how to care and love again.
Yeah, the next study is going to be people who grow up with animals less likely to commit crimes. And my bet is that they will be.
Yeah.
It just, there's something special about connecting.
Yeah, it definitely teaches you respect and love. And it's so amazing because animals they just love us unconditionally. And even animals that have had a really rough start, or animals that have been abused or have been abandoned, they love again. Their heart is there. They open their heart, and it's easy for them to fall into a family and just love and be there unconditionally. And that's an amazing thing about them.
Oh, in addition to love, all these other gifts that you've talked about that they give us. Now, one of the gifts that we haven't talked about that you alluded to earlier was the things that we have learned through veterinary science, which you deal with, that actually end up helping humans.
Yes. Advances in veterinary medicine, obviously we know they help animals, but they also help people. And it's really a neat thing, and one that I know you know very well, is that medications, for instance, a condition in dogs, KCS or dry eye, for years veterinarians were using the drug cyclosporin to actually treat that. And it actually was very successful, didn't have side effects, and worked incredibly well. And so
ophthalmologists used to recommend to go get the veterinary cyclosporin to our patients.
And now you guys have your own, right?
Yeah, it's basically the same version that came out for us.
So, and that was just incredible, and it was something that we were using for years in animals. We knew that it was a very safe drug. We knew that it was effectively treating the disease, and so it's one of the fallout benefits that came to people. But there's so much more. There are veterinary ophthalmologists right now that have worked with vision-losing diseases, specifically retinal degenerative diseases in dogs as well as cats. And one of the most incredible studies to me is a study in Briard dogs that actually looked at these dogs that suffered from a hereditary disease that was leading to blindness, and it's very similar to the human disease, retinitis pigmentosa. And as you know, that affects 1 in 3,500 Americans.
This is what you're alluding to as one of the most important advances in medicine.
Yes. So this veterinarian, specifically Dr. Christina Narvstrom from the University of Missouri, who's been just an amazing researcher and someone who's really done incredible advances for veterinary medicine, worked with the Briard dog and actually did gene therapy to correct the defective gene and was able to incredibly restore vision in blind Briard dogs. So incredible research. Like I said, it gives me goosebumps that you could take a blind animal and give them vision
and
again.
Here's, I mean, because I'm an ophthalmologist, as your husband is, one of the things that was amazing about that is that dog went to Congress. And from that dog came a huge amount of funding because when in the one eye that they treated that the dog could see with, the dog could navigate a maze, et cetera, and the other eye nothing. And that just impressed them so much. They got a huge amount of funding, and there are human trials going on now that will probably result in the elimination or treatment of blindness that before was science fiction.
Yeah, and that disease, retinitis pigmentosa, has no cure for it. So
no treatment.
You know, so the fact that there's possibly going to be a cure that came out of work with animals that not only, like we talked about, is going to benefit animals, it's incredible to me. And the same researcher, and she's a veterinarian, like I said, and just a wonderful person. The same research, she's looking at cats too. She's looking at Abyssinian cats right now that suffer from another genetic disorder that also looks like retinitis pigmentosa in humans. And she's currently using stem cells and injecting them in the back in the retina, and again, finding some success with that. And she also will be doing more gene therapy with these cats, but she's also using the silicone implants and implanting those in the back of the retina, and they're acting like an artificial retina. And those are very early studies, but I know stuff like that is going on with humans too, and they're kind of looking at what she's doing and the research. And you know, again, not only will her research benefit these blind animals and enable them to chase mice again, but also it could help 100,000 Americans that suffer from this disease, which is incredible.
It is incredible. It's an incredible time to be alive, to think about those kinds of things. There's work on vaccines that has been done. With cats, I think, more often, because the cat genome is similar enough to ours.
Yes, very similar to the human genome.
Yeah, these are wonderful things that have been benefits to us, and I am loving having Petey here, I have to tell you.
I think he's having a good time.
Yeah, well, I'm going to take him home, I think. Are you going to come home with me? Yeah? We have an obligation. We have an obligation to take care of these wonderful friends of ours that come into our lives and give us these incredible gifts.
For all the things they do for us, it's, you know, it's just imperative that people know how to properly care for their pets.
Well, and so in the last 5 minutes that we have, we've been talking about how pets help us. I think we can give a couple of minutes to how we can help them.
Absolutely. Well, I think we talked about before, you know, it's very important that people choose the right pet and they make sure that they get a pet that fits with their family. So whether that's a dog, whether that's a cat, whether that's a fish or a bird, as we talked about, any animal is good for your health and they just provide a lot. But you want to look into, obviously, people want to look into what's the right pet for their family. But then it's important that people know that just like us, they need routine medical care. They need to go to the vet right away. So as soon as anybody gets a cat or a dog, they need to see their veterinarian and make sure that the animal is healthy and that the animal is disease-free.
Right. And I need to point out that we took our dog to you when we got our dog. And what you did for us was you educated us a little bit about what we should do.
Yes.
Because anybody can buy a pet, but that doesn't mean you're prepared to take care of them.
No, and that's the thing that people need to think about too. Obviously, there's all these health benefits, but they do need to be taken care of, and we owe it to them to make sure that we take care of them responsibly. They need routine medical care. They need routine vaccinations. They need to be on deworming medication. They need to make sure that they have medicine to prevent internal and external parasites like fleas and worms. We need to make sure that if you have a dog that they have training, because that's important to make sure that a dog is trained so that it fits well into your family and it is a well-behaved pet. We need to also make sure that our pets are spayed and neutered. That's just something that we have to do. There still is an over-pet population no matter what all the shelters do, and there's been incredible progress in shelter medicine with combating this problem, but we all need to do our part and make sure that we spay and neuter a pet. And, it's not just for pet overpopulation, but there's health benefits for them. Spaying an animal decreases, a female dog decreases their risk of getting breast cancer, and in males it prevents them from developing testicular cancer. So it's really, really important that people do that. And again, that people just see their vet and make sure that they're stay on top of getting them in and getting, regular appointments to make sure that they are disease-free and don't develop any medical problems.
Both these animals are wearing collars.
Yes, that's a very, very important thing. It's really important that all animals have a collar and tags. And I'm also a firm believer in microchips as well. The collars and tags are important because if an animal gets lost, it enables anybody off the street that finds the animal to pick them up, and it would have information like the pet's name and a phone number to reach you. That's really, really important because right away your animal can be found and returned to you. Even cats need to have collars. A lot of people think that if they have a strictly indoor cat, which I believe cats should be, that they're never going to get outside, so they don't need a collar. Well, that's just not true. In today's times with hurricanes and earthquakes and all the different things that we have and fires, it's a cat can get outside, and if they do, it's just imperative that there's a way to get them back to you. And that's where microchips come in, because these collars and tags can actually fall off. And if they do, then again, how do we get them back to you? And that's where a microchip, which is implanted under the skin, enables a veterinarian or a shelter to actually track down the owner of the pet and get in touch with you.
Well, thank you so much for joining us again.
Thank you.
And giving us your valuable time. We're gonna keep bringing you back to talk about this because I think it's so important. So once again, very, very much appreciate it.
Thank
and
you very
for
much for
bringing
playing
these guys.
with Petey.
Oh, my pleasure. You've been listening to Dr. Ruth MacPete, a specialist in veterinary medicine, talk to us about the value that animals have in human health. And I don't think anyone would doubt that Petey has been very valuable to us today. And all of you out there who are looking for alternative and complementary medicine, animals are maybe the ultimate in complementary medicine and a low-cost, low-risk alternative to help your health. But remember, as much as they give us, we have to take care of them. I'm Dr. David Granet. This has been Health Matters, and we'll see you again next time. Want to say goodbye, Petey? Yep. Bye-bye.